Constipation and diarrhea. Normal bowel movements vary from 3 bowel movements daily to 1 bowel movement every 3 days. Constipation is the decrease in frequency of bowel movements from what is considered normal for an individual. It can include hard-to-pass stools, decrease in stool volume, and also retention in feces. Causes can include insufficient dietary fiber, inadequate fluid intake, decrease in physical activity, ignoring the urge to defecate. Many medications can also cause constipation. It can occur with diseases that slow GI transit, and stress and depression can cause. Bowel movements and laxatives. Some people believe they are constipated if they don't have a bowel movement daily. Laxative abuse can then happen, which can result in cathartic colon syndrome. Ultimately, the person becomes laxative dependent. Symptoms of constipation include the inability to have a bowel movement, abdominal discomfort, stools that are hard, dry, and difficult to pass, abdominal distension, bloating, increased flatulence, and hemorrhoids. Complications of constipation include hemorrhoids, fecal impaction, perforation, rectal ulcers, fissures, diverticulosis, and these complications are often more common in older people. Treatment for constipation includes increasing the dietary fiber, increasing daily fluid intake, and using stool softeners, laxatives, or enemas depending on the severity and overall health of a person. Diarrhea is the passage of at least 3 loose or liquid stools per day. It can be acute or chronic. It's considered chronic if it lasts longer than 4 weeks. The primary cause is infectious organisms that were ingested, which attack the intestines. It can be viral or bacterial, but not all diarrhea is due to infection. Large amounts of undigested carbohydrates in bowels can produce diarrhea, as well as lactose intolerant can cause diarrhea. There are different organisms that can cause diarrhea. Some are well known, such as E. coli, rotavirus, norovirus, and giardia. Some organisms alter the secretions or absorption of enterocytes in small intestines, and others impair absorption by destroying cells and inflaming the colon. Others produce toxins that cause damage, such as C. difficile. Treatment of diarrhea. The treatment depends on the cause. Avoid the foods and medications that cause it, but typically acute diarrhea will resolve itself within 48 hours. The main concern is preventing transmission and maintaining fluid and electrolyte replacement and balance. Antidiarrheal agents may be helpful. Antibiotics are rarely used, and for healthcare workers, follow infection control precautions and always practice good hand hygiene.